All right, it is 6:02, so let's not waste any time. Let's jump in. And the great thing about Zoom is that people can continue to join us over the course of this hour. Before we get everything started, I just want to let everyone know that this presentation is being recorded. We want to be able to have it saved and be able to be shared in the future, so it is recorded right now. As mentioned, it is a webinar style presentation. So what that means is you'll be able to see the panelists, you'll be able to see our speaker, but we do not see you. If you would like to interact with us this evening, just go to the bottom of your Zoom screen. We have two options for speaking with us today. There is the Q&A section where you can drop a question as the presentation goes on. We will have a Q&A section at the very end of the presentation. So if you have questions that pop up throughout, please leave them in the Q&A box and we will return to those questions at the end of our presentation. You can also speak with us via the chat. I will be keeping an eye on that as well. So if questions just happen to come in through the chat instead of the Q&A feature, we will still make sure to get to those. So no matter where you put your questions, we will answer those at the end of the evening. And without further ado, I am going to jump on board and introduce you to Dr. Penny Gordon-Larsen, who is our featured speaker this evening. We're so welcome. I'm so excited to welcome Dr. Gordon-Larsen this evening. She is an Associate Dean for Research at the Gillings School of Global Public Health, which many of you know is actually our home. We may be in Kannapolis as the Nutrition Research Institute, but we are based out of the Gillings School of Global Public Health. She is also a professor in the Department of Nutrition, so very close connection to a lot of our faculty members. Dr. Gordon-Larsen became the Gillings School Associate Dean for Research in September of 2018, and in her role, she leads a school-wide research program of approximately $200 million in research funding each year, which is a very big deal. She provides intellectual and strategic leadership and vision for research programs and for supporting and enhancing the school's research enterprise. Dr. Gordon-Larsen's research program is supported by the NIH, and a lot of the work that she does in her research focuses on issues related to ethnicity, disparities, and development of obesity over the life cycle, with some special attention to pathways linking environment and behavior to cardiometabolic risk. Today, she's going to be speaking to us about the Gillings School of Global Public Health research response to COVID-19, as Dr. Gordon-Larsen is instrumental in the leadership of COVID-19 research at the Gillings School. So Dr. Gordon-Larsen, I will turn things over to you right now. If you want to take over the screen, and if you have any issues, just let me know. I'm here for support the whole time.
Great. Well, can you see the screen? Is it all good?
That looks perfect.
Okay. Excellent. Well, thank you so much for the nice introduction. And it's wonderful to be able to talk in this Appetite for Life series. And I'm really pleased to be here today to talk about the exciting work that's going on at the Gillings School of Global Public Health around COVID-19. And so at UNC, there is a huge range of work that's happening related to COVID-19, but I'm only going to be focusing on the work that's really central to the Gillings School of Global Public Health. So before I start, I want to acknowledge the deep and horrible confluence of COVID-19 and racism that has had a dramatic impact on the state. And so there are a range of factors that have exacerbated the impacts of this devastating virus. And these include socioeconomic factors, racism, and structural factors, clinical health, access, and quality of care, and information. And we know that COVID-19 is higher in Black, Latinx, and American Indian versus white Americans, and that deaths are higher in areas that are that have severe housing problems, higher unemployment, higher incarceration, and food insecurity. And we also know that Black and Latinx Americans are more likely to try to get tested, but less likely to actually get a test. So all of these factors really relate cyclically to the disparities that we see in COVID-19 and the higher impacts in Black and Latinx Americans in particular. Another thing that really plays into the higher COVID-19 case and deaths in non-white populations is the general higher chronic disease risk. So that we know that diabetes, asthma, hypertension, heart disease all have a relationship with higher risk of COVID-19 adverse outcomes. So our approach at Gillings has been like all of our work. It really ranges in a self-to-society approach as we work to address every angle of the pandemic. So today I'll talk about work that we're doing that ranges from the basic science to the development of therapeutics and vaccines to mathematical modeling and to mitigation and community risk. So from the very start of the pandemic, our faculty were called on to work with the North Carolina Department of Health and Human Services. And so I show on this slide two main people, Kim Powers and Mark Holmes, who were called on by DHHS to help with the mathematical modeling and to predict or forecast what hospital capacity would be like. And so from that point on, with the first brief in April, and along with Leah Devlin, who's shown in the bottom panel, Allison Aiello and Ross Boyce, have really been working very closely with DHHS in all capacities in relation to our state level response to COVID-19. And at the same time, Gillings researcher Ralph Barrick, who happens to be one of the world's well-known coronavirus researchers, was ready to spring into action. And so indeed, his work really led to some of the earliest inroads with therapeutics for COVID-19. So for decades, Dr. Barrick had been warning about the potential for a pandemic virus, and in fact, a pandemic coronavirus that would jump from animal hosts to humans. And he was already doing work on SARS-1 and MERS. And so he was already almost ready out of the gate with broad spectrum antivirals that could work across a range of coronaviruses. And so Ralph's work really meant that he was poised with drugs, therapies, and vaccine targets in mind. And so his lab was directly involved in developing remdesivir that was approved for emergency use authorization in human populations, and with the EIDD 2801, which is being tested in phase 2 collaboration with Merck. And his team is also contributing to human monoclonal antibody therapies in the Operation Warp Speed clinical trials and in testing human performance in human phase 3 trials using his high throughput platforms to screen vaccines and drugs for their ability to induce high neutralizing antibodies, which is what they use to assess the response to therapies. And so you can see the Moderna vaccine, he has been working to look at the human response to that vaccine, and so engaged in that very exciting new work with these two vaccine candidates. Lissa Lavigne, who is in the Department of Biostatistics, is advising the clinical study design for the active trials, and these are the major clinical trials that underlie all of the therapeutic intervention and vaccine work. And she's using her expertise in clinical trials methodologies, and she's developing these master protocols that allow multiple agents to be tested in a very adaptive platform trial. So agents come and go depending on the availability and accumulating evidence of their safety and effectiveness. So this is a really novel and rapid way to assess performance of these drugs and vaccines, which is really exciting. And we're right there in the middle of all of this at UNC. In early May 2020, the North Carolina General Assembly appropriated $29 million to the North Carolina Policy Collaboratory to support research on treatment, community testing, and prevention of COVID-19. And this is mandated in that bill. And we, as a result, have a number of projects, research projects that are intended to provide new data and information to guide the state lawmakers and policymakers to really help the state's response. So I'll talk about the Gillings School's COVID-19 legislative projects. We have a number of these. Ralph Barrick, who I've already mentioned his name as one of the leading experts, has 3 of these collaboratory projects. He has an antiviral accelerator, which allowed Ralph to set up a series of vaccine testing studies at the Gillings School. He also received funding to support high throughput equipment, which allowed him to really ramp up and turbocharge his ability to test many types of vaccines and therapeutics. He has also been working in partnership with the School of Medicine and School of Pharmacy on the rapidly emerging antiviral drug discovery initiative, or READY, which is a really novel drug discovery pipeline to identify and develop antiviral drugs to treat and or prevent COVID-19 infections. And that's a really interesting kind of study and project because they are this is a partnership with virology, medicinal chemistry, biochemistry, and viral pathogenesis. And the idea is really for pandemic preparedness. So not just addressing COVID-19, but really looking ahead to address if there were to be a second pandemic or a new pandemic, that these drugs would be already in pipeline. So that's very exciting for now and for the future. We have a big project on wastewater viral monitoring that's led by Rachel Noble and Jill Stewart. And this is a surveillance project where they can go into sewage systems and wastewater to take samples and test for community level presence of SARS-CoV-2, the virus that leads to COVID-19 infections and disease. And so they are able here in partnership with scientists from across the state to be able to do this kind of surveillance, which can help in places where people can't get access to testing supplies or testing kits. So they can really rapidly predict the emergence of SARS-CoV-2 virus that can basically, it's like a 4 or 5 day lag between, like if you start seeing signals in the wastewater, then you know that the community is going to have a high level of cases in the next 4 to 5 days. And so they're really using this novel way of monitoring, which is really fantastic. We have a project on reopening schools. Kim Powers and Allison Aiello are conducting a systematic review and surveys with teachers and parents across the state to better understand how to keep everybody safe from SARS-CoV-2. And they're trying to figure out the best ways to enhance safety practices and make sure that we can get schools back up and running and get students back in classrooms. We have a project in Pittsburgh that is it's a study on Mount Ayr meat processing plant. So in the same way that the previous group is looking at schools, this group led by Natalie Bowman in medicine in partnership with Allison Aiello and Ross Boyce, they are going into this meat processing plant and they're doing a lot of testing, and they're looking to see what the how the transmission is occurring and what safety protocols could be put in place in meat processing plants, because we know that these kinds of settings where low-wage workers are working very close together need to be protected. And this is a critical kind of industry given that they are producing food for the state. And so they're studying this cohort of food processing workers, and they are partnering with a community study in Chatham so that we can understand the transmission, not just within the workplace, but between the workplace and the community to hopefully protect from future outbreaks. And this will help us to identify and inform workplace policies and engineering controls to really minimize transmission. And similarly, there's a project called Carolina Prosper that's led by Lena Nylander-French and Laura Linan. And this takes advantage of a 20-year project that is funded by the Occupational Safety and Health group. And so this is a NIOSH-funded occupational health project where they combine workplace wellness, which Laura Linan is an expert in, with environmental safety. And what they're doing here is figuring out how to reopen specific kinds of occupational sites. And so they're looking at a variety of small businesses, larger businesses like supermarkets, and they're working together to, again, figure out how to open safely and how to keep workers safe and consumers safe as well. And so from this, they will be developing a set of guidelines and protocols and practices to put in place for all kinds of work sites. And as COVID spread, hospitals initially in the initial stages of the pandemic, and we're still feeling this now, they began to limit all non-COVID, non-emergency procedures, which early on was driving losses of over $1 billion per month for hospitals in North Carolina. And so to avoid future financial insolvency and economic hardship for hospitals in the wake of this pandemic, this research is really bridging the gap between planning for pandemic healthcare and economic supply and demand efficiency to help understand hospital capacities during an infectious disease period that can help with really predicting how we protect our hospitals and healthcare facilities and their financial viability. I'm going to go into a bit of detail on two projects that are working together to create a public-facing dashboard. And the first of these projects is called the Sierra Surveillance Network, and this is a project that is really working to coordinate across all of the work that's happening at universities across the state with state agencies and institutions, and to help get everybody on the same page so that we're using similar kinds of approaches to hopefully be able to get a better sense of what's happening at state level. And we're also developing protocols and sampling methods and tools to help people, researchers, workplaces, and anyone who's doing testing to identify the best practices for doing that kind of testing. And this is a big team. I am on this team as well as leaders from across health policy management, epidemiology, biostatistics, and we're all working together to really pull these resources and create these kinds of standardized protocols. And we partner with the Gillings Center for Coronavirus Testing, Screening, and Surveillance. And this project aims to create a resource center for COVID-19 and SARS-CoV-2 surveillance that will use the most modern kinds of modeling tools. And these tools then are going back and forth between the project I just mentioned to really share that wise advice across the state. We're also identifying efficient algorithms for pooled molecular testing. And so what this is it doesn't work as well now when we have high case numbers, but you can, for example, take a hull on a dorm and pool all of the samples together to test those samples. If there is a single positive in that pool, you then can break that down and test individuals. If there's no positives there, you've just done one test and can be efficient and save resources and move to the next hull and do the same thing. We're also creating a web interface, and this is going to be a dashboard to rapidly distribute all of these tools to anybody free of charge who would want to use these. And this team is led by Jess Edwards, who is a new and rising star in the school in epidemiology, and she's partnering with Daniel Westrike, who is a leader in mathematical modeling. And then you can see that we also have some of the world's best statistical and mathematical modelers on this project as well. So we take these two projects together, the Sierra Surveillance Network and the Gillings Center, and together, as I mentioned, we're creating a COVID-19 dashboard. And we're doing so with our partners. Notably, we're working closely with the DHHS and 3 of the largest surveillance studies that are led by the DHHS in our state. So in Chatham, in Cabarrus, and in Chatham as well. And then we have other partners like Fort Bragg, Mayheck out near you, more regional, First Health, and as well as the more local UNC groups and the UNC system schools and a number of colleges and universities from across the state. And then we are partnering with the North Carolina Institute for Public Health, with the Shep Center, with Frank Porter Graham, and with Carolina Demography, which is part of the Carolina Population Center on UNC campus. So the dashboard is designed to reach researchers, the general public, and legislators. And we are going to do geographic mapping for data visualizations of health data and demographic and economic data, so that we'll have a very good sense, not just of the cases, deaths, hospitalizations, but also how they relate to underlying demographic and economic data. So we are very interested in points of interest across the state relative to meat processing and packing facilities, prisons and jails, long-term healthcare facilities, colleges, universities, and community settings, as well as schools and daycares. And the reason that we're interested in all of these different kinds of points of interest is that they are places that are congregate, working, or living situations where if we were to see an outbreak, they might start at some of these places and then spread to communities. So we're very interested in tracking and understanding how that has happened in the past so that we can predict how that happens in the future. We have a lot of the disease event tracking and other kinds of epidemiologic testing that comes out of the emergency department data and the electronic medical record system and electronic disease surveillance and claims data, as well as hospital discharge data. So all of these kinds of data help us understand and get a handle on the COVID cases, hospitalizations, and deaths. And the demographic and economic data that we are collecting is giving us a sense of those disparities and where we might see cases in relation to race, ethnicity, education, household crowding, employment, occupation, and so forth. So this is a preview of the dashboard. I'll leave this up for a minute here so that you can get, if you are interested, the URL, which is gillingscovid19.unc.edu. And if you go to this website, you'll see there's a place to sign up with your email, and you could get alerted when the full website launches. And the full website will have a lot of information that will be helpful for the general public in understanding their risk and understanding some of the protective measures that people can do. And I have a slide and a few slides that will show you a little preview of the types of information that we have here. We also, in this same project, have wrapped in a crowdsourcing app that we are developing. Well, that this team is developing, Liz Chen and partners from across campus. And this is a digital tool that will track the community perception of physical distancing, mask wearing, and crowding. And basically, this is an app that they're developing that users will be able to input data on their own, that it will help individuals understand their individual risk, but will also help decision makers to identify hotspots. And then we can analyze those data as well and understand how to inform future research and interventions. And so the app looks like this. It allows a user to log in and log their location, identify how easy it is for them to self-distance, whether people are wearing masks. And the output is a readout that shows busy times and how many of these social distancing efforts are being practiced. So if you've ever used anything like the Google tool that looks like this, it will show you a place and popular times to visit. And so you can pick when it's not busy, and how crowded it is, how socially distant it is, and whether or not, people are wearing masks. So that this tool will be something that will be out there, and people can just download it if they want and be able to use it. And we'll have a link on our dashboard that will show the output from this, and that will also be a way to help the public understand risk and risk mitigation. We also have a number of nutrition-related projects, and I wanted to mention just one. This is a project led by Alice Ammerman. She is developing, or she has developed in the past, a food product called Good Bowls. And so this is a frozen food product that is healthy bowl-based food that provides a healthy alternative to the standard fast frozen food. And what she's doing here in this study is that she is working in a manufacturing plant, and she's put in a cooler as it's a refrigerated vending machine that they're testing to see if this is a viable option for workplaces. So they put this in, and they're charging $4.50 a meal for the Good Bowls, and then you can see that that corresponds to a $7.50 average meal from the vending machine, where you would pick and choose a number of different kinds of items that you can see are not all that healthy. And she's going to see if individuals buy these foods more, and if so, if they're happy with them. And if this is a viable solution, then it's something that could be put in place, not just in North Carolina, but across the country as well. We also have a range of projects that are funded by our Gillings Innovation Labs, and this is a mechanism that we have had at the school since 2007 with our large gift from the Gillings family. And in this, we have funded a number of projects that we hope are going to make a difference in COVID-19. So first, we have a project on household transmission modeling of SARS-CoV-2 in North Carolina. This is led by Kim Powers in epidemiology and Jess Lynn in medicine. And what they're doing is addressing an understudied issue, and that is household transmission. So most people take precautions when they leave their home to go out into the community, but we don't really know exactly how the virus is transmitted between people when they're home. So basically, if one person in a household is diagnosed with COVID, then they go home and are told to isolate. And so when they are in isolation, we know that a lot of transmission can occur between the individual and other members of the household, particularly in places where housing is very small and it's not possible to do a true isolation. And so what they're studying is what works to keep people safe in the house. And so they're taking very frequent measures of all household members in households that have been diagnosed so that they can better understand those dynamics. And Kim Powers is one of the world's experts in mathematical modeling of infectious disease. And so once she understands how that household transmission occurs, she can then better develop tools to help at a broader level. So ideally, if you have seen her name on several of the slides, ideally her work in schools on transmission, in households on transmission, and in communities on transmission will help us overall to better predict the occurrence and spread of the disease. And so once we get a handle on this, it will be extremely helpful for identifying the best ways to protect people moving forward. In addition, because we know that this is a very highly infectious respiratory transmitted disease, that once we understand this for SARS-CoV-2, it will help any future kind of respiratory outbreak that we have. Say we have a highly contagious respiratory outbreak in 20 years, this kind of information will help them get a head start on those outbreaks in the future as well. So it's really important work. Lori Carter Edwards is She is a professor in the public health leadership program, and she is working with colleagues at the World Tabernacle Church, the North Carolina Department of Health and Human Services, the Office of Minority Health and Health Disparities, and the Department of Social Medicine to leverage rural Black faith-based social connections to spread critical information about how to protect yourself against COVID-19. And they'll use this information to help communities across the state. We know that the rural Black faith-based churches and organizations are really important for all kinds of communication around health. And so Lori Carter Edwards has been working with these groups for many, many years. And so leveraging these groups is a way to really connect with individuals across the full state and to help keep people safe, because we know that people trust their faith-based organizations, and so this really will be very helpful. We have another project led by Carson Bowman, who is an environmental sciences and engineering professor, and he's leading a project to test how long the airborne particles that are expelled by talking, breathing, and coughing remain in the air, and how long SARS-CoV-2 is contained in such particles and remains infectious. And so this is, again, very critical information that we need to know in terms of returning safely to any kind of indoor activities, schools, restaurants, universities, and more. So by understanding these virus dynamics, we can understand how to best clean the air, either through filtration or ventilation, to really exchange that airflow so that we can reduce those numbers of viral particles that are in the air. And we're combining this kind of work with similar work on surfaces. So how do we keep our surfaces clean and the air clean? So really important work. And Whitney Robinson is leading a project. She's partnering with NCDHHS and, the UNC Department of Infectious Diseases and Laboratory Medicine. And basically, when we started getting the outbreak, the only information that we were getting when we had very limited testing was from people who present at a hospital being sick. And there's a big need to be able to survey the asymptomatic population so that we can understand in people who are spreading the disease but aren't themselves sick, how we can reduce transmission from those people. And so when people are going into a routine antenatal care visit, which they will do multiple if they have small children, that this is a way, when they're already drawing blood through a heel stick or other kind of testing, that they're able to really rapidly get this information, and it could provide a really novel method of screening that could be put in place in hospitals around the country. So Whitney Robinson, who's a professor in epidemiology, is testing this out. At the same time, for pediatric care, we know that a major casualty of COVID-19 is the fact that COVID-19 has forced an end to most preventive healthcare visits. And as such, it's caused a drop in vaccination for children and adolescents. And so Noel Brewer, who is a professor in health behavior, is seeking new vaccination opportunities. He's creating a toolkit for providers with insights specific to pediatric telemedicine, and really identifying ways to entice people to come in and feel safe and be safe in getting vaccinations for their children so that they stay up on those vaccinations. And we know this is a critical issue right now with influenza and making sure people get the flu shot. Audrey Petafor is leading an initiative with collaborators at the University of Witwatersrand in South Africa, and she is looking to learn more about risk factors for COVID-19. The interesting thing about COVID-19 is that if you remember in the early stages of the pandemic when we had supply shortages, we didn't have the testing materials, we didn't have gloves, we didn't have PPE. This is a lot like what you see in a typical global setting. So in global settings, if we can learn how to work in low resource settings, it can actually be incredibly helpful for us in the US. So this is one such project that can really help us in identifying and understanding best response. And Jim Thomas has a project where he is developing a pandemic ethics dashboard, because we know that as this pandemic developed, as I said at the very beginning, that there were some very serious health inequities. And there are very serious ethical questions about any sort of pandemic. So who gets a vaccine first? Should schools reopen? How do you balance the risk between potential exposures in schools versus lapses in education? And we know that those lapses in education fall hardest on low-income and non-white populations. So how do we balance all of these risks? Well, Jim Thomas is an expert on this kind of pandemic ethics from other work that he's done in other global settings. And so he's developed a dashboard here where he's sharing consensus documents from the CDC, from WHO, and other universities on this kind of these kinds of ethical issues. And I put up here the pandemicethics.org is the dashboard website. So if you're interested, you can get those, take a look at those resources. So we are really eager to showcase what comes out of all of these projects. We're really happy that we're able to work across the state, and we welcome new partnerships. If any of the researchers are interested in working with us, we're happy to find ways to engage folks. And I will end by saying that despite all of the advances in medical treatments of vaccines, we still have 1 million dead globally and over 200,000 dead in the US. And other countries that have implemented strong public health prevention measures, including, across their entire countries, masks and social distancing, and have really worked with corporations to get people back to work safely. In contrast, we have not had an organized or systematic effort to do this. We've really had states doing their own kinds of efforts. And so I highlight here the positivity rate. So this is the numbers of tests that come back positive for COVID-19, so confirmed COVID cases. And you can see at the world and US that we are one of the highest countries in terms of test positivity, and you can see that it's increasing. I highlight Canada on this. This is actually, if anybody's interested, you can Google our world in data, and you can actually play around with these kinds of facts and figures on that website, which is just what I did. And I put Canada in. The reason I put Canada in is that you can see this slight uptick in Canada, where they have gone from a very low test positive rate to a very, not a very high, but a much higher test positivity rate here, more like 5%. And the reason I'm doing that is that this recent uptick related to Canadian Thanksgiving and followed the gatherings together that people did to celebrate. So just, a concern for what we might see after Thanksgiving holidays in the US. So I'll leave you with tips. These are from Anthony Fauci, the fundamentals of preventing, to prevent acquiring and transmitting SARS-CoV-2. So universal wearing of masks and cloth face coverings. It's not just enough to wear the mask. It needs to be properly fitted, make sure that it's above the nose and that it's tight across the face, and that you don't touch the front of the mask, and that you wash it in between times that you wear it if it's not disposable. To maintain physical distance from each other, at least 6 feet, to avoid crowds in congregate settings. That outdoors is always better than indoors. And if you are indoors, having ventilation is really important to keep air circulating wherever you are. And if you're indoors with people that you don't live with, it's good to wear a mask. So in shopping centers and so forth. And of course, frequent washing of hands. So I will end there and say a big thank you for letting me come and share this information about the work that we're doing at Gillings. And I will be very happy to take questions and hopefully can answer them. Just as a reminder, I am an obesity researcher, so not an infectious disease specialist, and so I'll couch all of my answers with that. So thank you very much.
Thank you for speaking. I know it's right in the name of the school, but I'm always so impressed and really blown away by the work that Gillings Global School is doing, because it doesn't just touch North Carolina, it really has a ripple effect globally on our world. And I think that's fantastic. It was really cool to hear about just how many projects are happening. And I'm sure you didn't even touch on all of them. So I think that's really the cool part about that. So I do want to open this up to questions. I'm just reminding everyone that you can leave questions in either the Q&A or in the chat feature. And while we wait for some questions to come in, I do have a couple that I can throw your way. The first being, do you think that these efforts are going to be useful for other types of pandemics that may develop in the future? Are we setting a strong foundation for that?
Yeah, I think for sure that we are. We're really ramping up and learning as much as we can about disease transmission, and that's really the part that that really was a huge setback at the beginning of the pandemic, because we didn't know how fast the disease spread. We didn't know how it was spreading. So we really, at the beginning didn't know. People were washing their mail and, doing all of these kinds of things that we now know are not the primary ways that the disease is spread. So we know this, and we now can recognize much more rapidly the signs of that kind of spread. We have all kinds of systems that we've developed to be able to jump right into airborne testing, surface testing, and all kinds of testing. So what we really hope, which is what I mentioned a little bit in the middle of the presentation, is that with all of this work that we can create the core of the mathematical transmission models, so that those models will be in place and can be adapted in the future. So it's possible not just that we get another pandemic, but this pandemic changes a bit. So it becomes either more contagious or less contagious, or it becomes more deadly or less deadly. And so all of these kinds of things would require modifications in the modeling that we're currently using. And we're learning more and more every day. So we have to adapt these, but getting these kinds of models up and running so that they can be adapted really sets us light years ahead for whatever comes next. And we have all these people who are working together who have never worked together before, which is really exciting, and also sets us up for really being able to jump on solutions quicker next time.
I think that's awesome. And just when you were saying that, it hit me that it really hasn't even been a full year since we here in the United States have been focused on this research and on this work, and to come so far and to already set the stage for the future in the way that you're saying, through collaborations and through setting up these models, is really incredible. I think that's so awesome.
It's incredible. I mean, it's also on the, on the drug development side. I mean, the reason that we have remdesivir is because Ralph Barrick was already looking at it for coronavirus, respiratory diseases. So he already was in a great spot with that drug, kind of already as a major candidate. And with all the knowledge that he has, being one of the world's, biggest authorities on coronavirus, that, he just was ready to jump on that. He also was ready with, the way that these two early vaccines are the way that they intervene in disease for protection is through the spike protein, which is part of the, of the virus. So it's like a cellular mechanism to stop the spread. And he knew that that would be successful based on everything that he's been working on in the past. So that's why we have these really amazing candidates so quickly. It's, unheard of to be, ramp up that quick with the drugs and vaccines as we are now.
Let's see. I don't have any in the Q&A or the chat, but I have more questions that I can give to you from so something that's just kind of came up as you were speaking, for some of the projects that are more North Carolina focused, do you think that there is an opportunity for that work to be translated on a broad level across the US or even possibly further? And do you know if any of the researchers who are working on those projects are planning to do that, or for now, is it going to stay North Carolina focused? And I know you touched on a couple of projects in this area, so I recognize that's a pretty broad question.
Yeah. No, we are partnering. I mean, we learn a lot from our neighboring states. I mean, one of the things, though, is that we have an incredibly strong Department of Health and Human Services and, a very strong state level response. And so we are learning by comparing ourselves to our surrounding states that aren't doing as well. We're learning from their mistakes. But we're also providing a model for other states and other countries as well. So this is a global pandemic, and we all are learning from each other. We work closely. This team, the mathematical modeling team, is actually working very closely with Imperial College in the UK, and so we're all, I think everybody is working across, with scientists from across the world very rapidly. So I think that's great. And a lot of the things we're able to do here, we'll be definitely able to do in other places.
Wonderful. Something else that I was just thinking about is, before I ask my question, we have one that came in through the chat. So I'm going to ask this question. This is actually from Dr. Natalia Kupenko, who's one of our faculty members at the Nutrition Research Institute. And she says that TV reports have shown disinfection of public places by a solution of, and I might butcher the word, isothiocyanate sprayed on the surfaces. This happened in Korea and Taiwan, etc. Are you aware of any studies on the effectiveness of such an approach in the US, Europe, or student campuses?
I am not aware of any of those approaches here. I think it's a great approach, and Korea, Taiwan, they did a really great job. South Korea and Taiwan did a really amazing job in the initial stages of the pandemic. And so we are looking to those countries as models because they, were very, very rapidly up and running with this. So there's a lot, to learn. So.
And we don't have a question, but just a little shout out here from Julie Ekstrand. She said that Duke University is also a partner here. Chris Woods and Dr. Kristen Newby are spearheading the Cabarrus County part of the NCSDHHS surveillance work and recruited from the Murdoch study cohort based in Kannapolis. I love that. Just another example of how our home on the North Carolina Research Campus allows us to collaborate with so many great people.
It's fantastic. I mean, that has been not just that the study is there, and so I thank Julie for mentioning it, but the recruiting from the Murdoch study has been tremendous, and so that group, Chris Woods, Kristen Newby, they have been able to get their participants enrolled really rapidly, and they've been leading in really understanding what's happening at the community level. So it's not just that it's happening, but it's really an outstanding example as well.
Something that I was thinking about is just how, with this pandemic, I think that it's been a really good opportunity for those who are not scientists to really keep abreast on what's going on. So you mentioned during your talk multiple websites and dashboards that anyone can access by going online. I feel like we've seen this in the news for months and months. Information is always being shared rapidly. What would you say maybe to the average person who wants to find out more about the pandemic, do you have any recommendations if they're looking for research coming out of Gillings? Should they stick to heading directly to the Gillings School website for news? Do you feel like a lot of the work that you're doing is being translated out in the local news? What are their best bets to make sure that they're getting information on the great work that's happening?
Yeah, so we have, UNC Research site has a COVID, and if you want, I can give you like a list of these so that if people ask, you could have them. But UNC Research has campus-wide information about all the COVID stuff happening at UNC. Gillings has a Gillings COVID site that's research oriented. And then the dashboard that I mentioned on this presentation will link out and provide a catalog for all of the studies across the state, contact people for each of the studies, reports and papers and visualizations and safety stuff. So it'll have a lot of information that'll be out there. So not just about the research, but also how to keep safe. But in the meantime, I would say that for the general public, the CDC website is really outstanding. And the North Carolina DHHS website has a lot of really good information as well. And people from across the state, as I mentioned, are partnering with DHHS. So in a sense, what you see on DHHS really comes from all corners of the state and, all of the work that many of the universities are doing.
I will ask one more question, leave it open, and then we'll have Suzanne Dane, our Director of Development, come and close things out for us. My question is, we've actually had Dr. Emmerman here on our campus to speak for Appetite for Life in the past, so we love good bowls, and I love that there is some nutrition-focused work going on surrounding COVID. One of our researchers here, Dr. Martin Kohlmeyer, has done a lot of work focused on vitamin D as a nutrient and its importance in the fight against COVID-19. I was just wondering if there were any other nutrition projects that you were aware of that didn't get shared tonight, and it's okay if they're not. It's just always on our mind at the Nutrition Research Institute.
Yeah, no, there's a huge number of studies. So there's studies to help, there's more practice-based stuff that's happening to get food out to kids who are, like, if their only source of meals is the school meal program, to try to reach them and get food to them. There's a whole range of projects. Roz Shake in the nutrition department, who you might recognize his name, but he's doing a lot of work, as is Melinda Beck, on the immune inflammation and that side of how COVID is affecting the body, who is at risk and why, and how does obesity and the obesity kind of immune and inflammatory pathways all work together to result in more adverse outcomes. So there's a lot of that kind of work. And then there's also a lot of health communication work that relates to nutrition. So trying to stay healthy, like, if you are stuck in your house and eating junk food all the time. There's also a lot of mobile technology. I know Deb Tate has come to talk to you guys, but Deb Tate in Carmina Valley, they have all of these mobile technology apps that are useful for, getting people to exercise, keep track of their exercise, encourage them to exercise, and eat well too. So they're, kind of covering all of those bases.
Wonderful. Thank you so much for sharing. All right, I'm seeing if there's any more questions. One more comment that just came in briefly from Julie, just saying, yes, proud partners. They've already had 1,430 participants in a matter of a week and are now partnering with the wastewater group. So that is just so awesome.
Amazing.
Thank you so much for sharing, Julie. Yeah. And thank you so much, Dr. Gordon-Larsen, for coming and speaking for us this evening. I know I learned a lot. I'm sure the rest of the attendees did as well. I will turn things over to Suzanne Dane now to kind of close things out for the evening. But again, I thank you so much for your time and for this wonderful presentation.
Thank you.
Hi, everybody. It's Suzanne, and thanks again, Dr. Gordon-Larsen. That was so jam-packed with really interesting information, even for those of us who work for UNC, even from afar. It's so much news that I didn't know, that I think that we all find useful and exciting to know that there are there are some answers on the horizon, and a lot of it's generated right out of Gillings and by our colleagues. So thank you so much for sharing all that great information with us and for visiting us at the UNC Nutrition Research Institute.
Thank you.
Thank you. I just want to say to everybody else who's out here watching, we appreciate you very much also that you come out monthly for these events. We're closing out our season of 2020 with this one, and it's probably very appropriate close to this year's presentations. We will be back in January with a whole new slate of programs. Watch your emails, follow us on Facebook and Instagram, and of course you can always visit us at uncnri.org and find information there. So thank you all for coming out and sticking with us month to month and letting us share our information with you. With that, I'm going to say goodnight, except to say I wish everybody a happy Thanksgiving and happy and safe holidays. And I implore you, don't congregate, wear a mask, and stay healthy. Good night.
Have a good night, everyone. Thanks for joining us.